employees are vaccinated?
We're actively encouraging vaccination in all of our employees and doing a lot of education and outreach in order to get our agency fully vaccinated.
And but the percent?
I don't have that for you today.
I'm told that 75 to some north of 75% of CDC employees at headquarters are still working remotely. Is that correct?
We are following regulations through HHS and the federal government.
No, that's not my question. I apologize to be rude, but I'm asking a very straightforward question. I've been told that north of 75% of employees at CDC headquarters are working remotely. Is that correct?
Senator, I don't actually know that number off the top.
Dr. Walensky, a couple things. As I walked in, I came in late. One of you or Dr. Fauci were saying that the reason that we're not saying that natural immunity is protective as is a vaccine, even though there's recent publications showing that 6 to 8 months out, 92% of those with natural immunity have T cells, B cells, and antibodies that would be considered adequate to protect. And indeed, B cell continues to climb. That we don't have data. Now, in your response to Mr. Casey, you just mentioned that CDC has access to tens of thousands of EHRs. And I've been told that HHS or CDC has access to patient-identifiable data as to who tests positive. So I do that as a prologue. If we don't know that natural immunity confers protection against future infection, it's because we've decided not to look. Because I've learned that there is a cohort of people that we know have been previously infected. We've got the bench research showing that the triad of antibodies, T cells, and B cells are there, and that 92% of them are still there at 6 months out. So why have we not done the research showing that natural immunity confers protection against recurrent infection?
Yeah, thank you so much for allowing me to clarify this point, because I understand the question. First of all, let me just reiterate that our current stand after reviewing 96 papers and a scientific brief on this issue is that everyone who's been previously infected should be vaccinated.
But that's not my question.
Right, agreed. And part of the challenge here is, as you know, the infection-induced immunity and the biases associated with retrospectively looking at the data. Several of those papers that we reviewed for that brief have demonstrated that the kind of disease that you had at the time you had it matters. Did you have disease a year and a half ago? Were you an older person?
Can I stop you for a second? We could do this prospectively, because you know who is actually, apparently I'm told you've got patient identifiable data, and you would be able to say, okay, 6 months ago, we're going to start everybody infected within the last 6 months, and be able to follow their EHR prospectively to see this. I mean, theoretically, CDC has the ability to do this right now.
Yeah, that too would have its own biases. So one of the things that we have demonstrated in the scientific brief is that asymptomatic and mildly symptomatic people who might not present to their providers, might present to an urgent care clinic, who might not be recorded in their own EHR, likely have less robust protection than those who've been severely infected.
But that could be established prospectively if using the data that you have. And you could even say, if you had symptomatic infection, you don't need to be vaccinated. We would consider you immune. You don't have to be subjected to the mandate. But
if we had data that demonstrated a correlation of protection, Dr. Fauci already mentioned data that they're working on to look at correlates of protection, not just in antibodies, but as you noted, in T cell function as well. So if we were able to document a correlate of protection, we absolutely could prospectively
But this paper that I'm reading from NIH speaks that there is durable memory of the virus up to 8 months after infection in 95% of the people who recovered, including B cells, which continue to climb, T cells, and antibody. And I'm also saying you could do it clinically, because we have data that's patient identifiable that we could go back and look and see if they were exposed. They could be in a hot spot like Louisiana, where you know they're being exposed, and then you would see, not just by lab data, but empirically. I can tell you the American people intuitively understand this, and they feel a little bit like we're being willfully blind to it. I have limited time. Let me just ask you something else. What percent of CDC employees are vaccinated?
We're actively encouraging vaccination in all of our employees and doing a lot of education and outreach in order to get our agency fully vaccinated.
And but the percent?
I don't have that for you today.
I'm told that 75 to some north of 75% of CDC employees at headquarters are still working remotely. Is that correct?
We are following regulations through HHS and the federal government.
No, that's not my question. I apologize to be rude, but I'm asking a very straightforward question. I've been told that north of 75% of employees at CDC headquarters are working remotely. Is that correct?
Senator, I don't actually know that number off the top of my head.
When you look down the hallway, are there empty desks? Are over 50% of the desks empty?
Senator, I don't have the numbers off the top of my head. What I will tell you is that we're working closely within HHS and the administration to follow the governmental rules for return to.
There was a recent GAO report that shows, and released in the last 2 weeks, that there's been no coordinated response from the federal government to get people back into work. Now, if there's any agency that, since teachers in Fulton County are back at work, that the caseload of COVID in Fulton County is about 88. At its peak, it was 606. If what I've been told by someone who frankly kind of knows, that people in laboratories are not showing up. I have no clue how laboratory workers who presumably are vaccinated wearing PPE would consider themselves eligible to stay at home. I say this because I just want to echo. We've got to lead by example in the federal government. If our public health agencies don't have enough confidence in the immunization and in the PPE to go back to work fighting infectious diseases, there's going to be a lot of undermining of a willingness to further fund public health.
We absolutely have our essential labs back at work conducting their essential research towards this response. And we are following the regulations and providing technical assistance and technical support to the federal government for return to work policies.
One more thing. Angus King and I had sent a letter dated February the 25th asking about genomic surveillance. We've still not received a response. You referenced it in your early remarks. Both Senator King and I would appreciate a response.
We'll get back to you. Thank you very much.
Thank you. I yield.
Thank you. I'm going to go vote. The next four senators I have in my order are Senator Baldwin, Marshall, Rosen, and Murkowski. I will return.
Thank you, Madam Chair. So we're here today to discuss the road ahead on the pandemic response, and I fear that that road will be a rocky one if we forget the lessons that we've learned thus far, particularly when it comes to our ability to make critical supplies.
It ends with a question that sounds almost embarrassingly simple. Senator Bill Cassidy leans in and asks the director of the Centers for Disease Control and Prevention, the top public health official in the nation, what percent of CDC employees are vaccinated? Across the witness table, Dr. Rochelle Walensky answers not with a number, but with a pivot. We're actively encouraging vaccination, she says. We're doing a lot of education and outreach. Cassidy cuts in. He's not asking about encouragement. He's asking about facts. He asks again. She admits she doesn't have the number. Then comes the second question, even more basic. Cassidy says he has been told that north of 75% of CDC headquarters employees are still working remotely. Is that correct? Again, no clear answer. More talk of regulations, of federal guidelines, of working with HHS. He tries a different angle. When you look down the hallway, are there empty desks? Are over 50% of the desks empty? Walensky still can't give a simple yes or no, and just like that, the disconnect is laid bare. Not between political parties, but between the institution telling America what to do and the public that's expected to trust it. This hearing had already covered deep, complicated science. Cassidy walked through studies on natural immunity, 8-month data on T cells, B cells, and antibodies. He cited NIH research showing durable immune memory in those who recovered from COVID infection. He laid out a scenario in which the CDC, with access to tens of thousands of electronic health records and identifiable testing data, could track people with prior infection and measure their real-world protection over time. His point was simple. If we don't know what natural immunity does, it's not because we can't know. It's because we haven't chosen to look. Walensky's answers, by contrast, were all about uncertainty, bias, limitations. Infection-induced immunity is hard to study, she explained. Some infections are asymptomatic, some records are incomplete, some illnesses happened long ago. She warned about confounding factors, about who shows up in the data and who doesn't. She leaned on the official position. Everyone, even the previously infected, should be vaccinated. To the average American watching, though, that sounded less like science and more like a wall. Cassidy spoke to that frustration directly. He said people intuitively understand that prior infection confers some protection. They see the studies, they see the experience of their friends and neighbors, and they feel, as he put it, that their government is being willfully blind to it. Then he turned to the part that hits at the heart of trust. If the CDC is confident enough in vaccines and masks to recommend mandates, if teachers are back in classrooms, if case counts in counties like Fulton have fallen from their peak, why are so many CDC employees still at home? Why doesn't the head of that very agency know her own staff's vaccination rate? Why can't she say whether most desks are empty? Cassidy's argument isn't subtle. If you don't lead by example, why should anyone follow your advice? When public health officials ask the country to change its behavior, to shut down businesses, to wear masks, to accept mandates, to vaccinate their children and themselves, they are asking for something more than compliance. They are asking for faith. Faith that the science is being followed, not bent. Faith that the rules apply equally to the people who write them. Faith that the experts actually believe what they are saying. So when the CDC director cannot answer, on the record, how many of her own people are vaccinated, that faith cracks. When laboratory workers, trained in PPE, steeped in infection control, are still working remotely while the agency insists schools and workplaces are safe to reopen, that faith erodes even further. This is what the hearing reveals beneath the numbers and acronyms. Credibility is not built on perfect models or polished talking points. It is built on straight answers to straight questions. It is built when an official looks a senator in the eye and says, "Here is what we know. Here is what we don't. Here is our own house, in order." Instead, we watched a familiar dance, a senator pressing, "You have the data. You could do this prospectively. You could exempt those with proven infection from mandates. You could show the country you're looking honestly at natural immunity." A public health leader falling back on process. "We reviewed 96 papers. We're working on correlates of protection. We're following federal workplace rules. We're providing technical assistance. Neither of those things is inherently bad. Rigorous scientific caution matters. Regulatory process matters. But in a crisis, when lives, livelihoods, and freedoms are on the line, they are not enough. The country doesn't just need experts. It needs experts it can trust. And trust is earned most, not in the complex explanations, but in the moments when the questions are almost painfully simple. Are you studying natural immunity with all the tools you have? How many of your own employees are vaccinated? Are your labs back at work? Yes or no? Those are the questions that echo when the lights in the hearing room dim and the microphones go quiet. Questions about whether the people steering the response are being fully transparent, or whether they are hiding behind the fog of bureaucracy to avoid uncomfortable truths. Because government is not just laws and agencies, it is the story it tells the people about what is happening and why. Justice is not only court rulings and mandates, it is the sense that sacrifices are shared, that burdens are fairly distributed, that those who preach precaution are willing to live by it themselves. Morality in public life is not measured only by intentions, but by the courage to confront new evidence, to adjust course, and to admit when you don't have all the answers, or when you do, and they're inconvenient. What we saw in this exchange between Senator Cassidy and Dr. Walensky is a fault line running straight through the American pandemic story, between data and transparency, between authority and accountability, between what officials demand of the public and what they demand of themselves. If that tension is allowed to fester in the dark, cynicism will win. People will stop listening. The next time a warning goes out, they'll shrug. The next time a mandate comes down, they'll resist. Not because they hate science, but because they no longer believe the people speaking in its name. That's why hearings like this matter. That's why these questions have to be asked again and again on the record. And that's why you're watching, because you know that the story of this country's response to crisis is being written in rooms like this, in moments like that simple, unanswered question. What percent of CDC employees are vaccinated? If you believe the American people deserve more than evasions, if you believe public trust is too precious to be squandered on half-answers, if you believe that those who lead must be held to the same standards they impose on everyone else, then stay with us. Subscribe to Congress Signal. Support our work to bring you inside these hearings, to show you every question, every hesitation, and every hard truth, so that the next time power speaks in the name of science, you'll have the full story, not just the headline.